Good morning or afternoon, whenever you're watching this. I'm Max Darling. My pronouns are he, they. I am a home visitor with the Confident Parenting Home Visiting Program at Las Cumbres Community Services. Formerly, I was a developmental specialist with the Family Infant Toddler Program at Las Cumbres. I work in Santa Fe County and Rio Arriba County as well. And I'm joined today by Jess Brennan, and I'll let you introduce yourself.
Hi, I'm Jess Brennan. My pronouns are they, them, and I'm a therapist at Las Cumbres Community Services. I work in Santa Fe, Rio Arriba, and Los Alamos counties. And today we are going to talk about what does it mean to be neurodiversity affirming and how can you be more neurodiversity affirming?
Awesome. So we are also going to just talk about the history of the neurodiversity movement and go into some information about what being neurodivergent means. And before we get started, I am neurodivergent. I have diagnosed attention deficit hyperactive disorder. And I also believe, I don't have an official diagnosis, but self-diagnosed autistic person. So I have the personal experience and also professional experience working with children on the spectrum. The program I used to work with, we would screen children for autism, and I would work with kids who had different needs and provide support for them developmentally. And so this is an area I'm very passionate about. So before we get started, I just wanted to share that little tidbit about myself. I think it's important to have people from the community speak to it, because I do believe that, you can do a training on autism and not be autistic, but it's a lot more impactful when you're a part of that community, or a part of that umbrella of being neurodivergent.
Definitely. I have personal and professional experience as well, and I'm currently in the process of completing training to become a certified OPT-PLAY provider, which is a type of play therapy that's specifically designed for children who are neurodivergent. And we'll talk a little bit more about what that means. It's particularly helpful for children who are diagnosed with ADHD or autism spectrum disorder.
Excellent. So we can go ahead and segue into what is neurodivergence. And if you'd like to talk about that a little bit, Jess, and give whoever's watching a little overview about what that means.
Sure. And before I get into that, I just wanted to give a quick caveat here about the distinction between person first and identity first language. So person first language is what we're often taught is correct to use, which would be saying something along the lines of person with a disability or person with autism, putting the person label first. And that actually is not what is typically preferred by people who are in those communities. People in those communities tend to prefer identity first language, so disabled person or autistic person. And the idea behind that is that these are aspects of who a person is that cannot be separated from them. So for the purposes of our presentation, we are going to be using identity first language because that is typically what is preferred by people within these communities. So I just wanted to get that out of the way from the beginning. And then we'll give a quick explanation of what do we mean when we say neurodivergent. So there isn't really a definitive list of what falls within the umbrella term of neurodivergent and what does not. But most commonly, when people say neurodivergent, they're referring to ADHD, autism spectrum, sensory processing differences, specific learning disorders like dyslexia and dyscalculia, and developmental disabilities. So that is typically what people mean by neurodivergent. And neurodiversity is the idea that all of these are just variations in what does it mean to be human, how do human brains work. It's the distinction between them being problems that make a person less complete and just natural variations, that there is no one correct brain type. And while being neurodivergent, having any of these diagnoses can make it more difficult to live in society, absolutely. They don't mean that a person is less valuable. And the neurodiversity movement really emerged in the 1990s and is about the rights of neurodivergent people and helping them to be seen as complete, wonderful members of our society who should be included in everyday society. And so we're going to be talking about how do we shift our lens to be more neurodiversity affirming, more inclusive of neurodivergent people. And I believe Max is going to be talking about some of the obstacles that we have to viewing people in this way.
Yes, thank you, Jess. So some obstacles, before we get into the obstacles, just to give some concrete examples for you all, what does autism spectrum disorder and ADHD, attention deficit hyperactive disorder, what do they look like? What are some indicators of them? So there is a bit of discourse about what are considered to be the most commonly known indicators. And I put that in quotes because I do think that there's a lot of stigma that is perpetuated around this because of information that is outdated. There has been more research that is current that has basically, for example, just to give you the most common one, if you hear the word autism, most people immediately go to lack of social skills, no eye contact. Those are like the two ones I hear the most in my field and and in my personal life. And while there are some people on the spectrum who do struggle with social skills, that can be a common component of being autistic. And eye contact can be very challenging for some people on the spectrum. It is a spectrum for a reason because it includes so many different things, and not every person who is autistic is going to look the same. So just to give an example, there are plenty of kids who are conditioned at a very young age, usually in a school setting, where they are redirected to making eye contact. And then for them, what we've learned from a lot of research is that the brain, actually the nervous system, registers that eye contact for some people, again, not all, in a very intense way. It can be overstimulating for some. It can be just completely draining to look somebody in the eyes. And it does trigger the nervous system and can have a very intense reaction for some. And because of that, when you are a teacher, for example, in a school, it's very commonplace for them to try to force a kid to make eye contact. So I'm talking about the harms, the harmful repercussions of that, and why it can be an obstacle. Now, when you're teaching a child to do what makes them extremely uncomfortable, it can often lead to them masking more. So masking is something we'll get into a little bit later, but it can lead to them basically doing something that does not feel natural to them, which can be harmful. So some examples of ASD in birth to 3, because that was my area of specialty in the past with early intervention. So toe walking is a very common indicator of autism. Unusual speech language patterns. So if you're looking at me, very hyperverbal, that's a good example. Oral motor concerns. So some kids have trouble like moving their lips in certain ways. They might have trouble with making raspberries. They may have trouble blowing bubbles. So the oral motor development does affect speech. Articulation issues, which sometimes can be paired with accelerated expressive speech. So what that means is they might have a lot of words. They just lack the coordination orally to be able to form them into coherent words. And if they're under 3, articulation is not a major concern, but once they get into preschool, at 3 or 4, that can be a huge obstacle, is being able to be understood in their speech. They might have a lot of things to say, but they can't be understood. And then skipping a stage of development. So not crawling, going straight to walking. Some kids will barrel roll. Some kids will just do really unusual forms of getting around besides crawling, and that can be an indicator as well. skipping stages of development, progressing ahead while missing some foundational steps. And now we're going to get into neurodivergent inclusive play, and I'll let Jess take over.
Often when we talk about what does it look like when neurodivergent kids and specifically autistic kids play, we think of some kind of stereotypical examples of lining toys up and not really doing anything with them, not wanting to play with other kids. And sometimes that's the case and sometimes that isn't, because if you know one autistic person, you know one autistic person. That's not necessarily the way that person presents, isn't necessarily representative of everyone on the autism spectrum. Everybody is different. Often when we talk about autistic kids playing, we think of, we need to change this play to make it seem more neurotypical or more like children who are not autistic, how they play. We need to make them engage and play with other kids. We need to teach them imaginative and symbolic play, rather than allowing them to play in the ways that feel comfortable to them. And this, a lot of times when we do things like this, it's well-intentioned. We think that we are teaching them to play in a way that will get them more of the benefits of play, when actually it's very harmful to try to change the way any child is playing. We actually are removing the benefits of play, because play by definition is something that children do that is not directed by adults. It's something that happens spontaneously and naturally, and it's a way for them to have fun. And if we try to direct a child to play in a way that does not come naturally to them, they're no longer playing. They're engaging in a task. And then we lose all of these benefits of play. So the way we can approach play with autistic and other neurodivergent children in a neurodiversity affirming way is to allow them to play in the ways that come naturally to them. So areas that tend to be frequent strengths for autistic kids in play are, one of them is called constructive play. And so this would be things like playing with Legos, or putting the face on the potato head, even games such as Minecraft. These are types of play that allow children to build something or to create a world. That's a typical strength for autistic kids. There's also sensory play, which would involve things like Play-Doh, or the little water beads, playing with sand. I know, Max, you had some other examples of sensory play, so if you want to jump in, you feel free to.
Thank you so much. Yeah, you touched upon some of the ones I could think of. Yeah, the water play is a big one. Especially, like, I see a lot of toddlers who, when they're close to 3, they have a hard time with drinking from an open cup because they want to dump it. They really seek that out. And I always recommend for parents who have that sensory seeking child who wants to manipulate water and things like that, for them to have a little designated area, maybe outside when it's warm enough, and have water in a bucket and things like that, making slime. There's so many different sensory types of play. I'm trying to think of any other ones that come to mind, but those are the main ones. Oh, as an example too is there are where there's like necklaces that kids can chew on. And some kids have that need to chew on things. And so we do recommend, if the child's old enough, they can have like a necklace, and it's literally called jewelry if you look it up online. And sometimes that biting can be soothing for some kids. I know I would have benefited from that as a child.
And what Max said about jewelry fits into something else that we'll touch on further later in our presentation about different types of sensory seeking behavior and how to deal with types of sensory seeking behavior that could be seen as harmful and how to substitute something else. So something like jewelry is a great way to substitute things like chewing on clothing or biting at skin, biting at nails. We'll talk about things like that a little bit more later, but sensory play in general can be a really good way of helping kids to substitute behaviors that could potentially be harmful. So we've covered constructive play, sensory play. The next one is functional play, which is using items in the way that they are intended to be used. So not all, but many autistic kids will not be as inclined to engage in imaginative or symbolic play. So things like pretending a banana is a phone. Not all, but a lot of autistic kids are less inclined to do things like that. So instead of trying to force them to do that, it's completely okay to use things in the way that they're intended to be used. So that would be providing things like a basketball hoop to shoot baskets, or puzzles, doing the puzzle, board games, reading books, things that are just used the way they're meant to be used. And then the final area, and this might be a little bit of a controversial one, is technology play. So that would be things just like playing on an app or playing a video game, and doing this either alone or with another child. A lot of times we tend to not want to acknowledge technology play as a valid form of play, but it is an area of interest for a lot of autistic kids and a lot of neurodivergent kids in general. And in the spirit of accepting all play as valid and allowing kids to engage in play in the ways that come naturally to them, it's important that we acknowledge that technology play is play. And it can often be a way for autistic kids to connect with other kids in a way that feels less threatening or less invasive, and can be a really important form of connection. So in order to be more neurodiversity affirming, more inclusive, we can provide toys that will allow children to engage in these types of play.
It's important to make note that when a child, whether they have ADHD or they have ASD, if they're on their phone or they're on an app or they're playing with a toy or like a fidget toy, that those kinds of things can be sensory aids if they're feeling overstimulated in a group. So what might look like somebody disconnecting and not paying attention might actually be them trying to regulate enough to pay attention and to not be so overwhelmed by whatever's going on, like the stimuli in the environment, the people. So for example, I mean, this also is relevant to adults. Like for me, sometimes I need to pull out my phone and it looks like I'm not paying attention, but it's really because I feel the need to be doing something. Like right now, I'm holding this pen because holding on to something keeps me focused. Otherwise, I feel like I'm going to tap my foot incessantly and I'm going to just be all fidgety. So if I have this, it keeps me centered enough to focus. And kids do the same thing. And so what may look like them checking out might be them actually checking in and helping themselves stay regulated enough to be present. So it's important to think that, like, to really consider that if a child is not neurotypical, then you need to really adjust your expectations that, like, not every child is going to present the same in how they are, focused on something. And of course, with toddlers, regardless of whether they're neurodivergent, focus is just hard for them in general. And that's something to be mindful of as well. But I just wanted to add that in there as examples. And I also was wondering, Jess, if you want to show at some point that picture just for those who are visual learners of that chart, because I think it's a really helpful representation of like how the autism spectrum works. And is it about neurodivergence in general or about ASD, Jess?
This one is specific to ASD, but
okay.
I do believe that while maybe a similar graphic either has not been created or I'm not aware of it, I think something similar could apply to, I mean, most variations of humans. But the graphic I have is specific to autism spectrum. I really enjoy this graphic because not only does it help us have a better visualization of what the autism spectrum looks like, but it also helps us to move past some outdated and ableist language. So a lot of people think that when they think of the term autism spectrum, they think of it as being a spectrum between less autistic and more autistic. And that's just simply not accurate. Or a spectrum between low functioning and high functioning, which are terms that we don't use anymore. Because really, autism affects every autistic person in different ways. So it can be very reductive to refer to people as low functioning and high functioning because, again, every autistic person is different and often will have a really hard time with some things and really excel in other things. So this model is what a lot of people think of, but it's inaccurate and it's outdated. So in reality, the autism spectrum looks a little more like this. And of course, everything that we show on this wheel is not an exhaustive list of things that somebody on the autism spectrum might experience, but it's a pretty good list. And a person might experience, say, a high level of anxiety. So be closer to the outside of the circle on that little wedge of the pie chart. But maybe they experience little to no aggression. So that would be towards the inner point of that little slice of the pie chart. Maybe this person has a lot of trouble with eye contact. Maybe their fidgets are somewhere in the middle. And so we could construct a visualization of to what intensity does this person experience many of the traits associated with autism spectrum disorder and get a much better picture of how autism affects this particular person rather than saying they are more or less autistic. Because when we're looking at it in terms of this wheel, that doesn't really make any sense because somebody could experience some of these traits to a very high degree and some of them little to not at all. So that gives us a more comprehensive picture of what does the autism spectrum look like to each individual person. And again, this is not an exhaustive list of traits, but it's some that we may see very visibly.
If I may add, Jess, some of these can be applicable to ADHD as well.
Definitely.
There's some overlap between the two, and a lot of research shows that if you are on the autism spectrum, there is a chance you could also have ADHD because those disorders are often co-occurring.
Yeah, there's a very high rate of co-occurring.
Yeah, so I just wanted to add that in there, but ADHD looks similar to autism, but it's of course different. But there are some similar aspects of it. For instance, the fidgeting aspect, especially for people who are more on the hyperactive side of that. And then sensory issues also can be common with people who have ADHD. And so there is some overlap between the two. And in terms of like the differences, I would say that ADHD is more like having an issue with either focusing or hyper focusing, an issue with impulsivity and motor movement. You might feel like you're constantly on the go, that kind of thing. And an issue with executive functioning and sticking to routines. So that can, and if you have that and you're on the autism spectrum, there's a lot of incongruency there, because if you're autistic, you usually favor routines. So there can be a bit of a chaotic thing where you want to stick to a routine if you have both. But then if you're ADHD, it's also, you get so impulsive and like hyper focus on things, and then you lose track of time. So then you can't stick to a routine. So it can be a bit of a chaotic mode for people who have both. So I just wanted to kind of go into that a little more, because we have been really focused on autism, which is great. But since ADHD is also in that umbrella, I wanted to just talk about that. Sensory processing is I wanted to mention that you can have sensory differences and not be on the spectrum. But a lot of people on the spectrum or who have ADHD have sensory differences. Not all, but a lot of them do. And we could definitely talk about that a little bit more as we go.
Let's get into sensory differences and sensory aids, how those can be helpful.
Perfect.
So we typically talk about two types of behavior associated with sensory processing differences, and that would be sensory seeking, which would be seeking out additional sensory stimulation. So that might look like wanting to look at bright lights, or being very interested in colorful things, or enjoying loud music, enjoying certain textures. That would be sensory seeking, versus sensory avoiding, which would be wanting to remove sensory stimulation from the environment. So that might be someone who really does not enjoy loud noises, needs to wear noise canceling headphones a lot of the time, somebody who's frequently asking to turn the lights down. Another common one is needing to remove the tags from clothing because it itches or it hurts. And sensory seeking and sensory avoiding behaviors is not a binary system. Most people who have sensory processing differences have a combination of both of these. They might be sensory seeking in some ways and sensory avoiding in others, or even with the same thing, have different ways of interacting with sensory stimuli based on whether they chose to interact with the stimuli and the stimulus in that way, or whether it's imposed on them, or what their energy level is that day. And an example of that might be, maybe this person really enjoys listening to loud music when they were the one to turn it on, but if somebody else makes a loud noise, it will be very distressing to them. Or maybe somebody really doesn't like bright lights, but enjoys a lot of like intense pressure, like a weighted blanket. So those would be examples of how somebody is not just sensory seeking or just sensory avoiding. It's usually a combination of both.
Exactly.
And I think everybody, regardless of whether or not they're neurodivergent, has sensory preferences, and just identifying with some of these does not necessarily mean that a person is neurodivergent. Maybe you just don't like loud noises or bright lights. But when it's something that maybe there are a lot of sensory stimuli that you feel sensitive to, or it persists in a lot of different environments, there might be some sensory processing differences going on, and that's totally okay. And sensory processing differences don't necessarily mean that somebody has something like ADHD or is on the autism spectrum, but most, if not all, people who are on the autism spectrum or have ADHD do have sensory processing differences. So when we use the term stimming, that's short for self-stimulatory behavior. And what that's referring to is when you see somebody who is neurodivergent or has sensory processing differences, engaging in behaviors like using a fidget toy or rocking back and forth. And the function of these behaviors is to help somebody to self-regulate. So oftentimes, neurodivergent people have a harder time self-regulating than neurotypical people. And these kinds of stimming behaviors help the person to regulate themselves and to feel calm and safe in their body. And a lot of times these are behaviors that we try to get neurodivergent people to stop engaging in. And that can actually be very harmful. And the question that comes up is, well, what if that stimming behavior is harmful in itself? And so the question I would ask is, well, is it really harmful? Because maybe some stimming behaviors can make neurotypical people feel a little bit uncomfortable, like watching somebody rock back and forth or spin around in circles or make certain sounds. But those behaviors aren't really hurting anyone, and they are very helpful to the person who is doing them. And when we talk about stimming behaviors that can be harmful, some kids are sensory seeking in a way that can harm themselves or others. I will use an example of my own, is that when I don't have something to fidget with in my hand, sometimes I will tend to pick at the skin around my nails, and it's a bad habit that I try to stop. And at the same time, that behavior serves a purpose. So it can be really helpful for someone like me who has a stimming behavior that can be harmful in that way to have something like a fidget toy to replace it. It can be easier not to do that if I have something else to do instead. An example we brought up earlier is the jewelry that you can chew on, and that can help. Sometimes we might see kids sensory seeking in a way that leads to like biting or chewing on things that they shouldn't, or even biting other people. And what's going on is that we're seeing this as aggression when really this person has a need to be chewing on something to help them to regulate, and giving something like jewelry to do instead can help to substitute that harmful behavior. So when we're looking at stimming behaviors, it's important to ask, like, is this really hurting anyone? Because it serves a purpose for the person who is doing it. And if we decide, yes, this can be harmful to that person or to someone else, to, instead of trying to stop the behavior, to substitute it with something that is not harmful, so that that need to self-regulate can still be met, but the harm is eliminated.
Precisely. Yeah, it's really, really important to redirect them. Some people have a tendency, it's very common with parents, where they want to just remove it entirely.
Mm-hmm.
And so they just want them to stop. And if they don't have that alternative to, depend on, it can be extremely difficult for them to stay regulated and to focus and to feel safe, actually. So what Jess is saying is very important. And one thing I wanted to mention, and this is kind of going back to an earlier conversation we had about play, is what's really important too when you're playing with a child, for example, who's neurodivergent. It's really important, like, to follow their lead with play, and to not put expectations on them to change behaviors in a way that can be really dysregulating, overstimulating to them. So if you see them stimming, to add what Jess said, like, that can be helpful for them. So a lot of times if you perceive it to be harmful or bothersome, it's often your own internal conflict with that behavior maybe being overstimulating for you. So you may want to focus on grounding yourself so you can be present and supportive of this child. And then I would recommend, following their lead. And it's really important not to disrupt their play. And, like, for example, if they're not pushing a car back and forth and making vroom sounds, they're lighting cars up. That might be what feels safe for them. And there's an article I would like to send a link to for when this recording is sent out, and I'll have
It'll be on the references list.
it'll be on the references. Great.
Mhm.
And so the article mentions that there's no such thing as appropriate play. Children learn through play, and they might not play with things like a neurotypical child would. And that doesn't mean that it's wrong. They are still learning. It just looks different than what you would expect of a neurotypical child. So it's really important to remember they might not be playing with the car the same way that a neurotypical child would. They might be watching the wheels on the floor and laying down and watching it from an angle to see how it works. They might not be making vroom sounds. You know, they may be doing that. You know, every child's different. But what my point is that they might be looking at it in a different way than you would expect. And it's important not to take that away from them and to just follow their lead, and not try to correct them, because when you correct them, it is difficult for them, because it makes them feel like it could be a self-esteem issue. It makes them feel like they're doing something wrong. It makes them feel discouraged and unsafe. And of course, if they're doing something harmful, that's different. That's hurting themselves. That's totally different. But it's really important to follow their lead and have them feel like they can play naturally, and just to participate with them at their own pace. And going into that, I'm kind of skipping around here.
Can I just add one thing to that?
Oh yeah, absolutely.
Of course. And I would also add in that it's important also not to assume, based on how you see a child playing, that you know what their internal experience of that play is. I would say very often children, neurodivergent children on the autism spectrum will have a very rich internal world that they don't always express to other people. So you might see play that just looks like lining things up or running back and forth. And what's actually going on in that child's mind might be much beyond anything that you would visually be able to see from that play. It might not, but it's important generally, when we're working with anyone who's neurodivergent, to just not assume that what we see and what's going on the inside are the same, because often, and particularly with autism and other forms of neurodivergence, it's really hard to express what's going on inside.
Yes.
And so it's important not to assume that somebody doesn't have a rich inner world just because you can't see it.
Absolutely. Yeah, I definitely agree with that.
Mm-hmm.
And I was wondering if you want to move into what area you would like to move into. I know that this is out of order, but I did kind of want to talk about body autonomy while we're talking about play.
Sure.
I think it's relevant here, what we're talking about, following their lead. And this is really applicable to all children, in respecting body, all people, but we're talking specifically about children, but yes, all people, all humans, we should respect body autonomy. But we want to highlight how it can be especially crucial for kids on the spectrum or who have ADHD in that neurodivergent umbrella.
Yeah.
Because what happens is there are some kids who have
disabled person. A lot of times we take away their body autonomy, and that's not okay to do.
It's not. And what is really hard for some kids, for many kids who are neurodivergent, is there is a tactile defensiveness, which means these kids might have issues with tags, like Jess mentioned earlier, in their clothing, and they might be hypersensitive to touch. And so for them, when somebody touches them, they don't register it as a neurotypical person would. And again, there can be neurotypical kids who have sensory issues with tactile stimulation. So I want to just include that it's not just kids in that umbrella, but for the sake of this conversation, I'm talking specifically about kids under that umbrella, that it can feel like a huge shock to their body, and that it's really hard for them to register, and they either get tensed up. Some kids will arch their back, and it makes them feel defensive. Some kids don't register it, and they're hyposensitive, And so they barely register it. And so when they're scratching themselves, some kids will scratch themselves, some kids will pull their hair. They're trying to seek that sensation because it's not registering as strongly. So for them, it's like they're trying to get a reaction in their body. So it's really important when you're playing with kids that you really ask for consent, which I don't think that we think to do, especially with babies, especially with toddlers when they're not talking. There are ways to ask for consent or to talk to them and read their body language. And it's really important that we do that. And I don't think a lot of people do, especially with babies. With babies, it's a little harder because they don't have really a way to communicate that, except for like crying and things. Like obviously if they're uncomfortable, you want to stop. But like for toddlers who can speak or gesture, not all toddlers can speak, but if they communicate in some way that they're uncomfortable, they walk away, they look away. It's really important to ask for permission before touching them. And I think we wanted to highlight that because body autonomy is especially disregarded with kids who are neurodivergent. We often want to touch them, to do hand over hand guidance, to like force them to sit still. And it's not okay, because if they're registering that in a way that feels invasive, it can actually
Or even painful.
It can be painful, yeah. Their nervous system is completely going haywire when those things happen. And so we're doing it to control how they are expressing themselves, and that can make them feel out of control of their own body and unsafe. And so it's really harmful, and we need to really address that, because I do see that happen a lot with kids who are neurodivergent. Anything that you wanted to add to that, Jess?
I would add that that body autonomy also extends to any aids that a person uses. So any sensory aids, any mobility aids, such as a walker or a wheelchair, a guide dog or a service dog if they have one, that the person's body autonomy extends to those things too. And you don't touch those things without the person's permission. And that consent also applies to people who don't speak verbally. It might not be as simple as asking, can I do this? Can I touch this? And having a verbal yes or no, but it can be about reading the person's cues. Does the person withdraw? Does the person yell? And that if a person is giving you an indication that they are uncomfortable with this touch or this intervention with what they are doing, that you stop.
Yes, and for some kids too, like when they're masking or hiding, I shouldn't say hiding, but trying to adapt to a neurotypical world by putting their best foot forward, so to speak, or seemingly, but really it's unnatural for them. It can also seem like they're okay with it when they're not. So there are some kids who will openly express it, whether or not they have the words to do so can vary, but there are some kids who will go along with it because they feel pressure. And it's really important too to think about the power that you have. So if you're an adult with a child, you have power over them. And so there is a power dynamic of some kids will mask and like do what you want them to do because they know you're in charge. And it's really important to make them feel like they have a say in their body, because some kids will not show that they're not consenting, if that makes sense. So there are some kids who will openly express it, some kids who won't. And I think it is important to recognize, like a child, for example, might go along with it, but when you actually touch them, you can feel how tense they are. And then it's like, oh shoot, like they didn't seem uncomfortable when I asked or when I approached them, but and you need to recognize those cues and walk away, and respect that, because some kids will go along with it. So it is important. There are kids who are more unmasked, they express themselves freely, and ones who mask, who feel like they need to adhere to neurotypical expectations. And so it is complex, and it is important to consider, like, what are they telling me, or what are they showing me because they don't have the words, or what behaviors are they expressing that could indicate discomfort in any way. It's really important to consider all those factors.
Right.
Yeah.
And of course, just to make a little caveat, there are some exceptions when someone's direct safety is at risk. Like, we're not saying if a child's tendency is to run and they're about to run into traffic, don't grab them.
Yeah.
We're not saying if a child is trying to touch a hot stove, don't stop them from doing that. And again, just bring up that concern of, is this harmful, or is this just a behavior I don't like?
And it's important because, and just from a trauma-informed lens, and I'm sure Jess can, speak to this too, is that if you don't do this for all children and people in general, it does condition them to feel that they're not in control of their own body and that they don't have a right to say no or advocate for themselves in whatever way they can do. And so later on, that can lead to them being in unsafe situations because they don't feel like they have a say over their body autonomy. It can really ingrain in them this fear of not being able to consent to things, like of not having that say, and almost like seeking out situations where that's allowed, where touching them is allowed, and they don't get to say no to it because that becomes like normalized for them. We do it a lot with families. Families expect hugs and kisses, and those things, some kids might love that, but for neurodivergent kids, it can be a lot, especially for family members that are extended family members they don't see a lot. Some kids are okay with their parents doing that because it becomes a routine.
Neurotypical kids might not feel comfortable with that, and that's fine.
Exactly. And so we need to really think, like, I know that parents and, aunts and uncles and all kinds of relatives want to hug and kiss, kids in the family, but we really need to check, like, are they comfortable with this? Because if they're not and you're doing it, you're teaching them that their discomfort doesn't matter, that this is how it should be. And that can have a lot of negative repercussions in the future. And, people do it naturally. I don't want anyone to feel bad hearing that. It's just something to be mindful of because it can be really hard for some kids, whether they're neurodivergent or not.
Yes, so I know we've used this term a few times, but I just wanted to give a bit more of a definition and explain some of the effects that this can have on a person. When we talk about masking, this is something that not all, but some neurodivergent people will do in order to make themselves appear more neurotypical, to appear more like someone who is going to be accepted in society. So that might be, for example, making eye contact, even though it feels overstimulating or it feels invasive. Or that might mean speaking verbally when it's really uncomfortable to do so. Or watching everyone around you all of the time and trying to copy their social behaviors. And the effects that this has is that it's exhausting. It takes a lot of energy to mask one's natural traits all of the time. And a lot of times we look at neurodivergent people who are able to mask and even mask to a degree where we don't see their neurodivergent traits, and we might call that person higher functioning. When in reality, that constant masking is taking a toll on that person. And people who have these abilities to mask tend to have much higher rates of things like depression and anxiety. Some estimates say it can be 80% or higher of neurodivergent people who mask heavily will have a diagnosis of depression or anxiety. And it can lead to things like self-harm, like suicidal ideation. It's very harmful to expect people to mask. And oftentimes, we do expect neurodivergent people to mask. We do expect them to behave in ways that are acceptable in neurotypical society. And I think it's very problematic because we're in a time where we're shifting towards being more accepting of human diversity and allowing people to be who they are. And we're not extending that same acceptance to neurodivergent people. And it has really big consequences. And so that's what we're talking about when we're talking about being neurodiversity affirming, is to accept people as they are and not require them to mask so heavily that they're burning out, that they're getting home at the end of the day and just not being able to speak. Not that it's bad to not speak, but when somebody normally does communicate verbally and they've just had such an exhausting day that they come home at the end of the day and abilities that are normally comfortable for them are not anymore, that is a big consequence that we're seeing for these people. And as people who interact with neurodivergent people, we create a safe environment for somebody to be themselves, we can prevent some of these consequences from happening.
Yeah, absolutely.
Did you want to add anything to that, Max?
Yeah, I wanted to say that for masking, a lot of people, it is problematic, and we're going to get into some of the ableist language. And in fact, I think this could transition into that if that's okay. Is one thing that I think can be a bit ableist that people don't realize is you look at somebody and you say, "Oh, you don't look autistic." That's what I hear a lot, and a lot of that has to do with like masking. A lot of people will mask so much that, you know, right now I'm gonna just admit I'm masking. Like I mean, there are moments where I'm like, oh, it's getting hard, but I am, because you have to, in order for me to function, I have to get in this mode where I am trying to be my best self, and it takes up so much energy, so much of my energy, so much of my like mental, emotional bandwidth to be able to just like push forward. So a lot of people don't believe that I'm on the spectrum. And you know, when I go home and I'm done with work, I tend to be very different. You know, I tend to, you know, have my fidget toys, and I do things that are just very different than how I am at work, because that's how I function. So there are some people on the spectrum who have trouble masking, and so their indicators of autism or even ADHD are very apparent. And then there are some who have trouble unmasking, and I'm definitely the latter. I have trouble presenting as somebody. I mean, people usually recognize the ADHD because, let's be real, that's pretty obvious with me how fidgety I am. But the autism aspect is something I've learned to mask my entire life, which has made it really hard for me. So I tend to be, you know, seemingly functional, and I'm saying functional in air quotes because I think it can be harmful to say that. And then I go home and I curl up in a ball because I haven't presented that version of myself inside. I'm just struggling. So there's like a dissonance between how I'm presenting and how I'm feeling inside. So that's just to give an example from a personal lens.
Right.
But ableist language, going into that.
I just wanted to add something
Oh,
real
yeah.
quick. Sorry.
Yeah, go ahead.
That can also look like things that might come automatically to a neurotypical person, like how do I have the right tone of voice for this situation, or what is the appropriate facial expression to make. These things might come naturally to a neurotypical person, but to a neurodivergent person, these things are things that have had to be learned by watching how other people do it, and they might not become automatic. This
Yes.
person might constantly be thinking of, does my facial expression match what I'm saying right now? Is my tone of voice correct? And again, I'm noticing this in myself right now. Like, I am not speaking in my normal tone of voice. And I think, you know, everybody does it to a degree.
Yeah.
But for somebody who is neurodivergent, one way that it's been described is like, it's like trying to do your everyday life while also just doing math equations in your head all day, because you're trying to figure out, you know, what's the right gesture? What is the right facial expression? Who am I supposed to be looking at right now? And that's exhausting, and it takes a toll on people.
The analogy of neurotypical people are in a car that's automatic. They just drive, they have to worry about the road, they have to worry about certain things, of course, but it's much more easy to manage. And then somebody who is neurodivergent, especially autistic, you're in a car and it's all manual and you have to keep going. Like as you go, you're in your head thinking,
you have to
like,
put the car together before you drive it.
Yeah. You're constantly managing things like, oh, am I being too fidgety right now? Am I presenting myself this way? Is this person like, okay, I really have to overanalyze this person to make sure I'm like understanding their cues. It's just exhausting work. So that's something to consider. So for ableist language, I wanted to cover some areas and then I'll have Jess go into it. So we already talked about low functioning and high functioning. And again, that's another binary system that's actually problematic because everybody, as Jess mentioned, is on the spectrum. There's no this or that. We tend to bifurcate things, which is a term that means separating things into two distinct branches. That's just how the brain wants to naturally work. You want to separate things into two concrete things you could understand. However, with neurodivergence, it's not that simple. And so, some people might have the ability, and I'm using the word function for the lack of a better word. Some people might function in society with a little more ease than others in certain aspects, and then struggle in others. So there's so many variables and situations that are unique to the individual. So it's not a cut and dry system. And then in terms of ableism, what I've noticed that's very prevalent is we tend to take stereotypical versions of what being autistic or being or having ADHD mean, and acting like it's applies to every single person. Some examples I've heard is everyone is a little autistic. He's too social to be autistic. She makes great eye contact. There's no way she's on the spectrum. He's a boy. Of course he's hyperactive. Doesn't mean he has ADHD. Now, ADHD tends to be, there's been a history of boys, especially white boys, being overdiagnosed with ADHD and then prescribed medication for ADHD at a young age. That is true. They tend to be active and need a lot of exercise that they're not getting. And so they tend to be overly diagnosed with ADHD and they might not even have that. That is true to an extent. However, there is a lot of gendered stereotypes of autism, ADHD that can be kind of harmful in the sense where, for example, girls in society, and this is just the way that people are treated based on gender. So people who are assigned female at birth tend to be treated as if, they are expected in society to socially adapt more and to be more emotionally expressive. There's all these like gendered stereotypes that people condition children to act like. In schools, teachers expect that, parents expect that. So they'll sometimes dismiss certain behaviors as, oh, like that's because she's a girl, that's because he's a boy. And sometimes it's like it's not really about gender, it's about neurodivergence, or because of expecting higher levels of functioning with social emotional development and with for example communication. We expect those to be higher for girls. We often dismiss the fact that like they could be autistic because they look like they are doing better because they're masking more, which is harmful because inside there's that crisis part of it, like I'm performing, so to speak, for other people and not being my true authentic self. For example, there's a lot of studies that show that kids will script, and so scripting is where you will say like the lines of a movie and you'll repeat them, and so you might have hyperverbal communication from a kid, and you might not see it as a problem, which it's not. I'm not saying that being autistic is inherently a problem, but you might dismiss it as, oh yeah, like she's just repeating this, she's a girl, she has a lot of vocabulary, this is what you expect, when really that can be a sign of autism, is scripting, remembering things, fixating on movies, being able to recite every single line, every single song. So because there's a hyperverbal element and you want a child to communicate, it's seen as like, oh, this is a good thing. And it can be a strength. I'm not going to deny that. It could be a strength. It could help with learning. But we also need to recognize that it could be a part of that. And instead of just making it into this gender binary of like, oh, it's because she's a girl, oh, because he's a boy, that can actually be detrimental to children getting diagnosed, because then we dismiss them based on gender stereotypes instead of looking deeper. And so one last thing I want to say too is that there is this misconception that being autistic, as I keep bringing up autism because I do think it gets more of the stigma than ADHD. And there's this misconception that people who are on the spectrum are not social. And there are some people who are autistic who are not social or don't prefer social stimulation, and that's valid and that's real and that should be respected. However, that's not the case for everyone on the spectrum. And I think what we really need to look at is how are they socializing differently? Like their form of socializing might be perceived as being different from neurotypical kids. It doesn't mean that they don't like it. You know, and some of them might enjoy being social. It really depends on the person. Like they might enjoy being in a social situation, but they might have trouble reading cues, like based on body language or nonverbal cues. They might need more direct communication. I'm one of those people who I like being social. It is draining for me, but I like it. But I do need that direct communication. If I don't get it, I tend to like overanalyze and think the person's mad and read into things that may or may not be there. And that can lead to conflict for me. So that's just an example, but it really varies person to person. So it's really important to keep that in mind. And then I wanted to get into the double empathy problem and have Jess cover that.
Yeah. Before I cover that, I just wanted to briefly expand on, you briefly mentioned that it's much more common for white boys in particular to be diagnosed with ASD or ADHD. Yeah. And just wanted to expand on that a little bit. Oftentimes for one thing, a lot of the research into what do ASD and ADHD look like, the research was performed on white boys. So we are expecting that particular presentation that's more common in white boys. And that's not the way it presents for everyone. So can mean that anybody who doesn't present in that way is less likely to be diagnosed. And often when white boys in particular exhibit these behaviors, people will recognize it as, oh, that child is likely on the spectrum, or that child likely has ADHD. And they will be referred for an evaluation and they'll be diagnosed. Oftentimes when that child is a girl or that child is a person of color, instead of somebody recognizing it as signs that this child might have ASD or ADHD, it's seen more as a personal failing of that child. So a girl might just be, oh, that she's shy. There's nothing we have to look into further. She's just shy. Or if that child is a person of color, it might be like that child's just really difficult. There's nothing we can do. And this is a huge problem because anyone can be neurodivergent. And it's important that we learn to recognize these signs in people who are not just white boys. And that instead of just assigning them as a personal failure, that we think there might be something else going on here. We might need to refer this child for an evaluation. So just something to think about. And I will, of course, get into what's called the double empathy problem. And that is an ableist idea as well, that not the concept of the double empathy problem, but the idea that people who are on the spectrum lack empathy. Yes. And some people might have trouble with the concept of empathy, but often what's going on is that people in general who have very different experiences of the world have trouble empathizing with each other. And the way that applies to neurodivergence is that people of similar neurotypes, so example, 2 neurotypical people or 2 autistic people, 2 people with ADHD, will tend to empathize well with each other. And people of different neurotypes, for example, a neurotypical person and an autistic person, tend to have a lot more trouble empathizing with each other because they don't understand the way the other experiences the world. And so this often leads neurotypical people to think that autistic people just don't have empathy because they have a hard time empathizing with each other. A lot of people who are on the spectrum have a lot of empathy, and they may have a harder time envisioning what it's like to be in someone else's shoes, or they might express that empathy in a way that doesn't make sense to neurotypical people. One example of that, and this is also very common with ADHD, is to when somebody shares something that they're going through, a neurodivergent person might empathize by relating it to their own experience. And to a neurotypical person, that might seem like, oh, you're just making it about yourself. I was trying to share something that's going on with me. When to a neurodivergent person, what they were trying to express is, I understand that. I feel what you're feeling right now. So it's just a mismatch in how do we communicate these things that can lead people, a lot of neurotypical people, to dismiss neurodivergent people as lacking empathy. So also something to consider.
And I think that just speaking to what would be helpful is that, and I'm not speaking for every person on the spectrum or every person who has ADHD, but if a person who is neurodivergent is trying to relate to you by sharing their experience that's similar to yours, and this is, I'm speaking specifically to neurotypical people, one thing that can be helpful for some people is just saying, like, I really need your support and I need you to listen. And being direct in your communication, setting a boundary that's like a very like gentle but firm, in the sense where you say what you mean. And I think that can be helpful, because if the person knows that they don't, like, you really just need someone to hold space for you and you need somebody to listen, then they're more likely to sit back and just take in what you have to say. And again, they might have a fidget toy, they might be doing something, and it might look like they're not focused, and they may not be, but it doesn't mean that they're not trying really hard to listen. So I think direct communication for some can be really helpful. Not everybody likes it. Some people, it just depends on the person. It's really important to communicate. Communication is key. It really is.
Right, to communicate what you're needing in this interaction, and also to not assume malicious intent.
Yes, exactly. To meet people where they're at. And also, if you don't know where they're at, to not just assume in your head and then treat them accordingly, to really ask them. So
and then one more, oh, sorry.
No, you go ahead. I don't know what I was.
That's okay. One more point that we wanted to make relating to ableist language and behaviors that often come up are to value all forms of communication equally. So neurodivergent people may communicate in a variety of different ways. Some might use verbal speech. Some might use ASL or other forms of sign language. Some might communicate mostly with gestures. Some people might use an AAC device, which is a technological device that can translate either like pictures or text into speech that other people can hear. And a lot of times when we're working with neurodivergent people, we want to try to force them to use verbal speech, because that's the way a lot of neurotypical people communicate, and to value verbal speech higher than these other forms of communication. Or so that might look like not allowing a child to use their AAC device, or trying to physically stop them from signing, and praising them when they use verbal speech rather than any of these other ways of communication. And it's really, really important that we value all forms of communication equally.
One thing I want to add is like maybe a closing thought. But I do want to wrap up with what we've been sharing. So we did cover a lot of different things today. We covered the neurodiversity movement, the history of it. We talked about some obstacles for people who are neurodivergent. We talked about neurodivergent inclusive play, sensory aids, harmful stimming. areas that are frequent strengths for autistic kids and the way that they play. We talked about those types of play: constructive, sensory, functional, and technology. And we've been covering ableist language and behaviors, body autonomy as well. So those were the main areas that we discussed today.
I just want to put our reference list up on the screen for a minute here.
Sure.
There we go. That would be our reference list.
Awesome. Thank you so much for sharing that. I just wanted to say that if you look at neurodivergence, it is one of the few, like the community of neurodivergent people is a marginalized community, and it is one of the only ones. And of course, you know, there are people who have certain privileges who are neurodivergent. Like I have white privilege, for example. I'm just going to acknowledge that here because I'm not going to say I'm like the most oppressed person, because I'm not. That being said, our society has accommodated marginalized communities. We try to be inclusive of gender and race and you know, religion, all different kinds of.
We're learning. We're not always good about it.
We're not always good about it. There's still a lot of work to be done, and we aren't even halfway there probably. But my point being is that we try to put the work on the people who are more privileged, because they have, like, for example, you know, if you're a white person, then you should be doing the work on, you know, anti-racism and other things to really learn from it and like to really be inclusive and accommodate people and advocate for people who, you know, are people of color, for example. And with autism and ADHD, we don't, as a society, accommodate them as readily as we should. We expect them to adapt to the neurotypical world. For example, as a gay person, when you work somewhere, generally there are laws, depends on what state you're in, where they're supposed to accept you regardless of what your gender or sexual orientation is. We don't have, like, as far as I know, and I'm sure there are places that do have this in place, but we don't have places that are like, oh, we're going to actually accommodate you as a neurodivergent person and make this place safe for you, less stimulating, more of a place where you can feel centered. So like we put the work on the autistic or child with ADHD to change their behaviors to fit in to our neurotypical society. And it's not right. We should be meeting them where they're at and making them feel safe. One thing I love about Las Cumbres, and this is the last thought, is whenever I've expressed a need about, like, for example, being on my phone or doing something on a call and explaining, like, I'm doing it to regulate myself, I've been really welcomed in this agency. There was a bunch of fluorescent lights above me where I used to sit on my desk, and I hated it. And one of the previous office managers took it out for me so that it was less overstimulating above me. And I just really appreciate that this agency is so open to, you know, meeting the individual where they're at. And I think that society has a long way to go with accommodating people who have different sensory needs, sensory aids that they require to help them do work. But I think we're starting to get there.
So we just wanted to thank you for listening to us talk about how to be more inclusive and affirming of neurodivergent people. And just thank you for showing an interest in this topic. And hopefully some things that we've said will resonate with you, and you'll be able to just be more inclusive when working with people with all different ways of functioning in the world.
So I thank you so much for your time and for listening to us. And thank you, Jess, for your collaboration with this.
Yeah.
Thank you. Take care, everybody. Stay safe.